no more Kegel exercises, ever. Ladies, today you are getting your permission slip to never have to do a Kegel exercise again. Ready? I have seen too many women who have been doing Kegel exercises, not getting the results they're looking for, and frustrated because they're not sure if they're doing it right, and it's definitely not working. So today I am going to show you the one exercise that I ask all of my patients to do who need help with their pelvic floor. And ladies, that is pretty much all of us. So I was asked to make this video specifically so people could send it out, because every time I teach a patient this, I ask them to teach all of their friends. Let's get this information out there on an exercise that you can do. You will know it's effective, you will feel it making a change, and you will not have to ever do a Kegel exercise again. Now, you may be questioning me because you've heard that Kegel exercises are the best thing to do, and you're wondering, why don't they work? And that's a legitimate question that I want to handle before we get into the exercise that will work. So Kegel exercises may not work, one, because you might not be doing them correctly. It's really hard to know unless you're using a machine to help assess that contraction. It's really hard to know if you're doing a Kegel exercise correctly. And honestly, if you're hooked up to the machine, sometimes it's hard to know even if you're doing it correctly then. But the second reason I think is the most important reason. Kegel exercises do strengthen the pelvic floor, but most often women do not have a weak pelvic floor. They have a tight pelvic floor. So if you take a muscle that's already tight and then try to perform a max contraction on it, which is what a Kegel exercise is that going to go well for you? So think about it. If you have a tight bicep and you are stuck in this position and then you're trying to perform a max contraction of it, like, what good is that going to do you? Is that going to help you be able to lengthen that bicep and actually be able to carry those grocery bags? Well, no, it's just going to make everything worse and want to stay up in here. So why would you do a Kegel exercise on an already tight muscle? That's why I have women do this exercise instead, because this exercise not only causes an active contraction of the muscle, it causes a passive relaxation of the muscle. And that is super important because we want to restore normal muscle tone. We don't necessarily need to make it stronger, but we do need to make that pelvic floor more effective in doing its job. So the next question I get asked is, why does this exercise work when Kegel exercises don't? The reason why is the pelvic floor attaches into the deep hip internal and external rotators, which are bigger muscles than the pelvic floor, because the pelvic floor is really thin. They're bigger muscles than the pelvic floor, and they help to cause that passive contraction and relaxation of the pelvic floor. So you're actually using bigger muscles to move the smaller muscles. So you don't have to use those smaller muscles quite as much. It makes it way more effective. I've seen way better results, and better yet, I have not seen any bad side effects. I had a patient once who went to a regular pelvic floor physical therapist, and that physical therapist had her do a whole bunch of Kegel exercises because she was doing some biofeedback to assess the strength of her pelvic floor, and shockingly found it to be weak. Of course, that makes sense. But what ended up happening is that it increased her prolapse from doing all of those Kegel exercises, because you're doing that bearing down when you're doing a Kegel exercise. And if you already suffer from a prolapse, then that's just going to make things worse. This exercise focuses on the deep hip internal and external rotators so that you have that passive contraction and relaxation of the pelvic floor, which will help to alleviate any prolapse you may be suffering with. All right. Here we go. Now, this exercise is not hard, but it is a little bit challenging to be able to do correctly. What you're going to do is make sure that you are lying down on a surface where you can slide your feet. Sliding is really important. So I have my socks on right now, and I'm on a table that will allow me to slide really easily. Some people like to do this in bed if your sheets are slippery. Some people will lay on a yoga mat and have socks on. Some people will put a towel or a pillowcase on a tile or hardwood floor. Whatever you need to do is fine. You just need to make sure that your feet can actually slide. What you're going to do is you're going to start with your knees and your feet hip width apart, and then you're going to slide your metatarsal heads towards each other. Now, your metatarsal heads are like the knuckles, okay? So like these would be your toes. The metatarsal heads are right here. That's what you're trying to slide when you're doing this exercise. You're going to do 15 sliding towards each other, and then we're going to switch it and do 15 apart. So let me show you what that looks like. So I'm laying on my back, knees bent up, knees and feet are hip width apart. I'm going to slide those met heads towards each other without, well, I'm a little bit too close, so I'm going to spread out a little bit more. I have pretty big feet, so I got to put mine pretty far apart. There we go. All right, now we're keeping those toes down. You don't want to lift the toes up. If you lift the toes up, you'll feel it more in the calf. And what we're trying to do is work these hip muscles up in here. If you don't feel your hips actually working, you can put your fingers kind of in your hips, and that may help you to be able to feel it. So you're going to do 15 this way, and then you're going to put your feet and your knees together, and you're going to do 15 the opposite way. Now, as you'll notice for me, I have less motion going in this direction, and that's pretty much true for everybody. That's why I start with the other exercise first, because it's way easier to do and you feel the motion more. But with this one, you just go as far as you feel comfortable with. No straining, no trying to, I'm trying to get it out there so you can see my toes start coming up, and I'm feeling a lot of stress in my calves with this. No. Just letting it slide as far as it feels comfortable with. There should be no stress or strain with this. Now, what you're going to do is 2 sets of 15 once a day just for pelvic floor health. So if you're like, I don't really have any pelvic floor problems, but this sounds like a good exercise, you're just going to do it once a day. Now, if you are struggling, if you're having any issues with incontinence, prolapse, or any pelvic floor pain or dysfunction, you're going to do this exercise twice a day, 2 sets of 15 twice a day. And I guarantee you, keep with it. It does take a little bit to see results, but within a month of doing this exercise, you will definitely see some changes. Now, if you have some questions about your pelvic floor health, or you are suffering with some pelvic floor dysfunction, then I definitely encourage you to check out this video here. And if you would like to hear more about the pelvic floor and how it's related to the rest of your body, I encourage you to check out my book, Movement is Life. The link's in the description below.